here with the delightful Dr. Justine Hextall, my favourite dermatologist when it comes to speaking about things that happen on our face and we don't know what to do about them. And today we're going to talk about perimenopausal and menopausal acne. So some of you might have never had spots and suddenly you're in a perimenopausal state. You're sort of in your 40s, the general time of perimenopausal, but it can change according to women's cycles. And you can suddenly think, what has appeared on my chin? So to discuss today with you, my dear, is why do we get them perimenopausally, especially if we've never had them, and how can we get rid of them? And what are they?
That's a great question, and it is a common problem that I see. So during the time of perimenopause, we have this real fluctuation in hormones. So estrogens go up and they go down, but eventually it settles down such that estrogen starts to drop relative to testosterone. And it is testosterone which actually drives oil in our skin, and that's where our pores can get blocked. So that change in hormones can trigger a perimenopausal or menopausal acne. But it's also important to remember that around the time of menopause, our skin changes. So it often becomes more dry and sensitive because it loses things like hyaluronic acid, which draws moisture to the skin, but also oils like ceramides. So the skin may become drier and more sensitive and more prone to inflammation. So it's really important that when we manage that perimenopausal acne, that we balance treating the acne, but also keeping the skin hydrated and calm. And also remember, and I see this quite often, you may have a coexistent rosacea, say for example, in the mid-face and acne on the lower face, and the treatments are quite different. So it's very important that you treat one but don't exacerbate the other.
That's a very good point, because I have come across so many women on Rethink Your Routine who have said, I feel it's acne. And what they're describing to me, I'm thinking, it sounds like rosacea as well. So the two can live side by side. Do you find that in quite a high proportion of your patients?
I think I absolutely do. And I find that they say, my skin's really sensitive. It just won't settle down. I've got these spots coming. It just feels really sore and dry. So that imbalance that occurs can cause increased sensitivity, increased irritation, can drive towards a rosacea, but also you can see an acne for sure, definitely. And that is why it's so incredibly important that you balance hydration with your actives for treating your acne.
I mean, there is something to be said for the difference between topical applications to help you and ones we take orally. So if I was to decide, if I took a lot of hyaluronic acid, is that in your mind going to help a little bit with just trying to support the dermis and give back some of the things that we're losing through our hormone fluctuations?
Taking oral hyaluronic acid?
Yeah, as well as topical.
You know, yeah, I mean, I think that there is evidence for things like sort of supplements like collagen, and there is some evidence for them for sure, particularly hydrolyzed collagen, so to try and support the skin barrier. But I also think that we shouldn't sort of forget what we can do topically. So I think that quite often people say to me, my skin's really dry because I don't drink enough water. And obviously it's very important to keep hydrated for lots of reasons, you know, for our general health, but also for our skin. But the truth is, most when people say their skin's dry and sensitive, it's because they're losing moisture from the skin itself. So things that you can do to trap hydration to the skin barrier, it's going to be really helpful.
It's a real balance that. There is definitely room for acids in everyone's routine, and I don't believe that if you go past menopause, you should stop using them. I'm 58, I went into menopause 12 years ago, and I use acids on my skin, but I use them with care and I check what they are, and I'm also giving that support into my skin as well, Justine, like we're talking about. But if somebody has active spots, like there's spots on their chin, so we're going away from the kind of rosacea areas and we're going like spotty, like I've turned into a teenager again, then what are things that are going to help?
Just to start with, sort of, you know, let's think about why it's happening. So we need to sort of really think about what's changed. So it might be, again, as you say, just that change in hormones. It might be that they're on HRT and they can't tolerate the progesterone on part of the HRT. It might be that they are putting too much sort of oily stuff on their skin. When their skin starts to get dry, they might be putting things which we describe as comedogenic. So they're trapping sort of oil in the skin. That may be an issue as well. But as you say, it could just be hormonal, and we need to try and help with that. And that is where sometimes as dermatologists we give medication, for example, things like spironolactone, to try and sort of suppress some of that sort of androgen drive.
When you talk about androgen drive, do you mean to do with testosterone?
That's right.
So describe that.
It's what drives the production of oil, which then blocks the pore, which leads to the acne. So it's trying to sort of get that balance back again. And as I said,
can I just say, I now so know something because I speak with Dr. Erica Schwartz, who's a hormone specialist. She talks a lot about andropause, and I now realize why andropause, which is male menopause, is called that, because they're losing testosterone levels. Okay, so we need to look at what we're putting on our skin. We need to think about our hormone levels and maybe go and see a hormone specialist if we're not already. And I would say nurturing and things to bring back in the moisture without just being heavy oils on the skin. So hyaluronics and things that are going to just retain moisture.
Yeah, that's a really good summary. Exactly.
And I just want to say you do get through it. I just, speaking from my experience, sort of 45, I went into menopause. 48, 49, I had such bad skin because also I was being prescribed incorrectly levels of hormone replacement therapy. I got on the right train with Dr. Erica and my skin became fine, and I'm through menopause now. I still take HRT. I'll take it till they nail my coffin down. All right, well, that was just a lovely snapshot, sort of midlife crisis skin. Thank you so much.
Pleasure, absolute pleasure.